Good afternoon. Welcome back. I want to again thank Speaker Melissa Hortman for joining me a few minutes ago. Good conversation. Now I want to turn the conversation to wellness and healing and community. Today we are in conversation with our partners from the Minneapolis Heart Institute Foundation, Dr. Courtney Jordan Beckler and Dr. Mosi Bennett. Courtney and Mosi have co-hosted 5 wonderful conversations centered on heart health with people in the community. And today we want to talk about what we learned from those conversations. One of the conversations featured me and my daughter, Batala, who's here today. Batala, remind listeners why we are here and talking about wellness, healing, and health equity. Hey, Batala.
Hey, how are you? It's always good to be in these public conversations with you. For people who may not be aware, or the people who are aware, we hosted a fitness challenge in 2014. We started the fitness challenge, and we had huge success with that. We serviced about 1,000 people who lost more than 300 pounds and more than 400 inches. And so we had success with that program. And we started to think, how could we expand our reach and how could we expand our relationships with our community partners, which included North Point Health and Wellness, community organizations like the Hawthorne Area Community and the Jordan Area Community Council. The success rested in the fact that people had an opportunity to receive these services from people who look like them. The invitation was there. What we know and what we heard from people is that, I would never be so inclined to join a fitness class because the instructors don't look like me. Nobody's from my neighborhood. And sometimes when I go to my doctor, it's not even a suggestion. I don't know where to start. And so we saw opportunity. And then we had COVID. And once again, the spotlight was brought on health disparities in Minnesota. Those of us who've been doing this work, we know that the disparities have existed for a long time. And then we saw very horrible public murder of George Floyd. And once again, the conversation was elevated. What can we do? The disparity in Minnesota, in a state that is often lauded as one of the most healthiest, has these disparities for its Black and brown residents. What can we do? And that's when I got a call from my friend Courtney, and she said, "Hey, listen, my organization, we're listening, and we want to be part of the conversation, want to be part of the movement, part of the solution. So what can we do?" And that brought us to this space to have these very public conversations about health. Courtney has been very instrumental in helping us develop our strategy for our Insight Health Equity Action Lab, which we are slowly rolling out. And we've done these 5 conversations. And one of the things that moved me was the willingness to be vulnerable. And the understanding when you can have those conversations, which sometimes as family, you don't want to share because you just don't know how people are going to respond. Like Dad telling people that you have congestive heart failure. It's even hard for me to say it because it's serious, but it sounds like no return. But we know through making adjustments in our lifestyle as a family that there is hope. And we believe if we continue to create the space for other people to share these stories that, we can move the solutions forward. So a little bit winded there, but I think everybody gets the point. And so I'll kick it over to Dr. Courtney or Dr. Mosi. But it's what you just said with your last conversation, Dad. It's the passion which drives your work. And I think that's why we're all here and want to do something in partnership with community to address these health disparities.
Well, thank you. That was quite the introduction, and it wasn't lengthy. It was beautiful. It's just been such a privilege to be able to have the chance to start diving into this work further. I think Mosey and I both represent the Heart Institute and the Heart Institute Foundation when we authentically say we have so much more to do, and we're so excited to continue down this journey, and in this conversation sort of speak to some of the themes that we heard and continue to see and how we get into this a little bit deeper. I think one of the takeaways for me, which I would like to say we knew, but I'm not sure if that's authentically true, but just is sort of the bi-directional nature of this work. For good or bad, medicine often naturally is sort of from the physician to the human. And I think these conversations have just illustrated how we have to approach that differently, that we have a lot of things to learn on the delivery side of things, in how we let people authentically be who they are and become 100% themselves and work together in partnership in new ways. So I think that was, for me, one of the biggest things that I took away is our need to listen more. How about you, Mosey?
Alan Batala, thank you so much for including us in these conversations. It's been, in reflecting back, it's been very, I think, productive and eye-opening. As Courtney was saying, it is a two-way relationship and understanding. And I think that as we started off talking about problems, talking about awareness, talking about education, that is actually the fact that we're discussing it, these sometimes difficult and personal topics, is actually part of the solution. Learning to discuss them and provide insight and education is part of the solution. If we don't acknowledge disparities, if we don't acknowledge the role of preventive medicine in our own health, and if we don't acknowledge the problems in the relationships between communities and healthcare, then we will never even start to address them. So we have to recognize that there are things, opportunities to improve, and try to work on them. And these conversations have been, in that vein, very, very important. So thank you for allowing me to be part of this.
Uh-oh, you're on mute. You're on mute.
Got it. Thank you. Thank you, Mosi and Courtney. I was thinking as you guys were speaking how I did go to my primary health care provider, Health Partners, client and patient, and based on talking with the two of you, got a referral to you. So I want to say that I'll be transferring my care to the two of you. I have to see how it works, but the feeling I have is that meeting you and having these conversations with you is important and personal to me, and I'm willing to say publicly that I am excited that I have the kind of healthcare or health insurance, et cetera, that allows me to move around and to be directing my own care. So I'm going to be doing that. The point of saying that is this: when Bobby, my wife, Batala's mom, and I got our second COVID vaccination and the first vaccination as well, here in our neighborhood, 4 blocks from where we live at North Point Health and Wellness, to get off the elevator on the 5th floor of what they call the Thor building and be greeted by Latina, African American, Asian healthcare professionals at the door, right? And to get the prep of the temperature, the regular screening, have you been out of the country? But all with this touch and with the sense of caring and the sense of welcoming. And I did not feel that I was imposing on them or making their life miserable. I felt that I was a part of what they do and who they are. And I saw them and experienced them as healers and as compassionate people that I knew were there to help save my life, right? And so the point of this is that how do we get more of our community like these healthcare professionals at North Point aware of and in the pipeline of being of service to each other. The problems of being alive will be with us forever, hopefully, and that means there's a customer base forever. How do we get more Dr. Mosey's and more Dr. Courtney's from our community, from our families, serving our families? How do we organize so that our community produces the scale the resources and solutions that will improve the quality of life for all of us? What do you guys think?
Well, I know Mosey and I have had some conversation about this from the beginning, that both of us are very interested in how the bubble that we live in, how we can be more strategic about filling that pipeline within cardiology, within research, just again, recognizing the need to have people look, understand you, appreciate your culture, and what a difference it would make if every organization started to really have that as part of their strategy. We have an internship at the Heart Institute Foundation every summer that is really a pipeline into medical school for pre-med students. But that's something that we've had a lot of conversation at the foundation with, of how do we be really smart about who's getting those spots and selective, and really looking at what an asset this is, to have people with better understandings, better awareness, better experiences themselves. What a huge asset that is, just like the other things that we look at as to whether or not you're a good candidate for medical school. So I'm actually participating in another conversation this afternoon about this same opportunity of how we partner more with different organizations, where we as a science center can really be helping connect with youth and adults. And I guess that's one way that comes to mind specifically for the Heart Institute Foundation. But I just think how much bigger that could be if everybody did that, to what you're saying. How about you? What are your thoughts, Mosey?
No, I agree. I think there's a benefit. Everyone benefits if the healthcare team, the team taking care of your health, is reflective of, looks like you, is reflective of the community. If there's diverse backgrounds and diversity on that team, everyone benefits. Everyone on the team benefits, and everyone receiving the care benefits. And that has been quite a challenge in our community, in our country, to reach that goal, where the team is the healthcare team is reflective of the people receiving the care. Less than 3% of all physicians now are Black men. Less than 3%. That number, there were more higher percentage of Black men physicians 40, 50 years ago than there are now. So that's just one striking statistic. It begins, there are many ways that we can augment that pipeline, from talking to children in grade school, to high school, to college, to providing opportunities for research, etc. So there's not one entry point, and certainly our efforts across the board will only pay dividends in terms of increasing diversity down the road, in years from now. But we have to make an effort. You want your team to reflect your values and your experiences. At least be aware of it and be understanding. And that comes with that's part of being compassionate. That's part of showing empathy and delivering care, caring about those that you take care of. So I strongly believe that we need to work harder and do more to increase the diversity in the healthcare team, up and down the ladder, across the board. So
Absolutely. And I'd say that's, one of the roles that we play as journalists and storytellers. It's to highlight those people in community who are all the way from our doctors to our lab techs, to our nurses, to our doulas. And it's also highlighting and partnering with those organizations that have those programs that introduce young people to health sciences. It's so important. It's one of the things I talk about, the invitation. In a conversation I was in earlier, I mentioned how when we would go to our old clinic, which has been shut down, how the pictures on the wall were people from community. The woman Miss Jane, who would greet you, she's known my mom and dad forever. Our physician, my mom and dad, we shared the same doctor for a long time, Dr. Kin. So people, like, I'd say 80%, 75% of the team at that clinic, they were reflective of the community. So those things are quite important too. And I think when you see that, it empowers you. And that's one of the that's one of the sorry, that's one of the themes too that we heard a lot about, how to be an advocate for yourself. You are your biggest advocate. I'm reminded of Laureline's story of how she felt that something wasn't going right in her body. She went to the doctor, and if I recall, she was told that it was an anxiety, to calm down, but she just didn't feel right, and she pushed. She pushed for a second opinion. She talked to her parents. She was aware. I think heart disease runs in her family, but she says that she's so grateful to be here today and uses her story to encourage other people to be advocates. But we know that a lot of folks don't share that space. So I think that's a huge piece as well. And it was very, I didn't know this, but I didn't know that with my father with heart disease, that I could go for a preventative visit. I didn't know that, right? So even I'm learning a whole lot as well. And I think it is very encouraging when we hear from doctors like you, Courtney and Mosey, telling folks that you can do this. These are your options. We invite you to get that second opinion. So if you wanted to speak on that again, I think that those are very powerful moments that came up in the conversations.
Yeah, I think what I would add to what you're saying too, Vitala, is sort of this ongoing understanding and research that we have about the better relationships people have with their physicians, the more likely they are to follow up and come back. And I think sort of perhaps the lack thereof those relationships that we heard as a theme when it wasn't working well in the conversations that we've had over the last 5 weeks, I think is something that we hope to build upon. Is how do we make it easier for the community, to what you're saying, Al, to know the places, the providers where they can expect it to be treated well, to not have to come with armor of what they think their diagnosis is, to hopefully get that second opinion if they didn't feel like they got the right one. Perhaps more convenient hours, to places that offer things besides Monday through Friday, 8 to 5, even when you can see a cardiologist. Like, we have Saturday offerings from that perspective, that just different things that make sense when people are looking for answers that work for their life and who they are. And I think, hoping to speak to what you said, hoping that makes folks feel empowered to be able to make that next step wherever they are in their health journey.
And I, just to add to that, I mean, the whole concept of empowering, being empowered when you go to the doctor is extremely important, and that you empower yourself with information, with the decision making and ability to get a second opinion, creating a good connection and relationship with your physician. It's all a part of becoming empowered. And being comfortable asking questions about a diagnosis, a treatment plan, and realizing that healthcare works best when it's things are not done in terms of giving orders, and it's a relationship. Everyone with illness or who needs help is different, and you have to see them in the context of their community, their personality, their family. Every relationship is different, and you can't be blind to that when you're trying to help and trying to deliver a therapy.
I often think, as a business owner, small business person, when I get depressed, sometimes I'll drive out through the suburbs to see all this new construction, new business, new vitality. And I always come back saying, wow, if they can do it, I can do it. There's something going on here, even though it's difficult in my neighborhood, in my business right now, but that sustains me. But it brings me back to another idea, and it's something that I heard my grandma say way back when. And she would say, mind your business, right? So I take that and apply it to this issue of our health, my health. And I use as kind of a catechism the idea that our health is our business. And I mean that in the way my grandma meant it, on two ways. One is that, pay attention, Al, pay attention, mind your business, you take care of you. But she also meant it in the literal sense of business. This enterprise is a business, right? So how do we both educate an awareness, an understanding in our populations that not only are we creating personal decision-making that will protect and sustain our lives, but this is part of a process, the creation of interconnected institutions that are massive business opportunities as well, that we can sustain our families, our community, grow our wealth by protecting and serving our health. That's a good line. I like that. But how do we change the understanding? How do we create an understanding about the value, beyond being healthy, which is obviously essential and critical, but there's even so much more. Health means so much more, and we simply need to connect, expand what health means. I think they use the term the social determinants of health now to talk about food insecurity, about the environment, about exercise, about the physical health, about mental health, and how do we begin to change our language, our descriptions, our narratives that bring us discussions that are multi-layered, complex, but accessible, understandable, that reflect the connectivity of all of these elements of this thing we call life. What do you guys think?
That is a weighted question and a good one. But I think basically, there's so much there of why this partnership is so important, and will require others to be successful. I mean, I think one, we fundamentally have to think of our health first, whole person, body, mind, and spirit, before our wealth and prosperity. And yet we're up against this, you look at Maslow's hierarchy of needs, and anytime you're talking about social determinants of health, understandably so, all of these other needs come up first before health. But I think what I always come back to, and I think Mosey will say this too, is at the end of the day, today, tomorrow, for as far as we can tell, the number one thing that brown and black people are dying from at a disparate rate is cardiovascular disease. Mm-hmm. It's not COVID. COVID's super important. But I just, we constantly go to, what's hot and these other things. And yet there's stuff right in front of us that we could do something about today and change that trajectory. But I think that this is where the point of doing it differently than it's looked before. It's probably more than simply knowing your biometrics and seeing your physician. It's about what you're talking about fundamentally feeling well inside, and being able to heal as a community. And that's where this is so intertangled with everything that we're seeing after George Floyd's murder, and it's these worlds coming together. But it's confusing how to solve for that going forward.
Now that's such a, we could spend days dissecting your comments and that question to try to get to an answer. It's so complex, and I think when we think about our health, we think of one measure of health, life expectancy. If you look at a map of Minnesota or Minneapolis, and you can see striking differences in life expectancy across the Twin Cities, years of difference, just depending on where you live. And of course, we mentioned the social determinants of health, access to healthcare, access to a neighborhood with the area to exercise, food. It's all intertwined. And then when you throw on top of that a pandemic, you see that this life expectancy among African Americans has dropped even further in just a year, more so than any other group. So we're dealing with a situation where there is a vulnerable group that is susceptible to all of these social determinants of health. It's important that we, of course, any way that we can tackle these, we need to take on. I mean, it'll take a multifaceted approach to make a difference. And it's your comments and your thoughts are excellent, and it's just such a complicated. There's so many factors.
Bassala, let me ask you to reflect on some of the exciting discoveries or conversations we had over the series. I'll throw out one that you can explain more than I can, but it was news to me to get the story about, and I may be saying this wrong, preeclampsia or preeclampsia. So that was a good conversation for me to be on, this impact of women's health and heart health associated with childbearing. But you might have others that stood out to you, Bassala.
Yeah, absolutely. That one was news to me as well. I did not know that. And on the conversation was my niece, who had preeclampsia with both of her children, and her mom also my sister had preeclampsia, and I just did not know that, but it made sense why. And Courtney, you can remind us of why, but also from that conversation, once again, we heard the theme of having to arm yourself with the information when going to your provider, because you may not get that. And so even with my own experience, and I had a team that was very aware. I've been with my doctor for a long time. Even remember, like, you had to eventually drive me out to Woodbury because she was like, you're at 38 weeks. You don't need to be driving from Minneapolis to Woodbury. But the discussion about gaining too much weight too fast or being mindful of my blood pressure, it never came up of these. If you do develop preeclampsia, this could be a risk. It was just like, you don't want to go there, right? And it was in conversation with my sister. So I thought, really, it was like mind blowing to me. Like, why aren't they telling us this? Especially Black mothers. Why aren't they telling us this? And all of them were just eye opening. Again, Laureleen's experience of being 35, I think she was, with an aortic aneurysm. It was, and then we had, even listening to Miss Stella from North Point Health and Wellness talk about not owning or acknowledging the acknowledgement of the family history of disease, but not owning that and deciding that, I'm going to be proactive. I'm going to make lifestyle changes. So that does not have to be my story as well. And that just stuck with me. So they were all just really inspiring personally. And again, back to our conversation, we talked about our food choices as a family, the snacks. I'm here to say that there's no snacks, very little snacks in the household. So those very small changes can end up, having a huge impact on how your life looks. That I think you're still not moving enough, but we're talking about that. So they were. I think those are the ones, and then also reconnecting in this virtual space with Miss Annie and Shavita, two participants in the fitness challenge who found more people found success with it, and Shavita acknowledging that she had just completed her PhD program and she was being overwhelmed, and she recognized that she needed to be healthy because she was a caregiver for her mother who needed the help. So she had to focus on her health, and in doing so, bring her mother into the program as well. And so I think like these are we know, and we don't want to fall in love with the problem, right? We know it's here, we acknowledge it, but there are also so many people who are working to improve their lives, but sometimes it's siloed, you don't know about it. And so there truly is this need for this collaboration, this partnership in community, this cross-sector collaboration, because talk about health disparities, North Point Health and Wellness, I mean, they have been committed to this work for 50 years, right? And doing good work. But the issue is they're expanding their campus because there's the need. And the issue is not here, not because of what they're not doing, because of systemic racism, right? And how do we dismantle that? That's, again, the complex task. Can be kind of easy, say like, get those people out, put these people in, but we know, we can say it, like, it's not that easy. But how do I think we know that's why we're here, but it's our hope, it's to tackle these institutions and these systems that took 400 years to build. And we know that it's not going to happen in a year. It may take a generation, right? And so, we're looking to connect, to hear the stories, to let these stories inform our work, and to see some results. But that takes the commitment, it takes the partnership, it takes people like Dr. Courtney and Dr. Mosey. And so we're grateful, we're excited, and just ready to keep pushing our sleeves up and get out, knock on some doors, pull some people in, have more conversations, and in doing so, just maintain personal health too and manage personal stress.
And so for the doctors, what do you all think this collaboration can do? What can partnering with the iHeal Project, the Insight Health Equity Action Lab, and Insight News and McFarland Media, the newspaper, what can we do to support your idea, your vision of educating, creating understanding that people can act on in our community? What are we hoping to deliver and create in this process?
Mm-hmm. I think we're hoping to ultimately see these numbers change, as Batala said, to not fall in love with the problem and the data, but to fall in love with the solutions and the change, and be that example for others to follow. And again, I think it's just so unique to bring together this group, recognizing the importance of the human experience, I think the commitment and history that you guys have all had in the neighborhood and in the community, and the Heart Institute and Heart Institute Foundation, I think, is really excited to show up and be a partner in that exploration of how we do things different on our end and make it easier to meet people where they're at and create that healthy environment for people to thrive.
So what can we do together? I think that this has been a fantastic endeavor, a fantastic start. And I'll call it a start because I think that the key is that this in some form should continue. I think that the common theme in some of the conversations has been education, empowering the individual and empowering the community. And also, we've heard several examples of wake-up calls, right? And I would argue that let's get to the point where we don't need and don't have wake-up calls. So that just comes from continue to empower, continue this type of relationship, collaboration, discussion, continue this type of education in some way moving forward. This is I'll call this the beginning of this endeavor, and it's not something that should be confined to these 5 weeks or these couple of months. This is something in this spirit should be an ongoing thing, and should become routine and expected and regular. And that's how we get all of us empowered, educated, and we won't have those shocking moments where we require or go through periods that we consider a wake-up call.
I consider that, Dr. Mosley, I call it creating a public mind. How do we, with intention, create a level of understanding and awareness so that these discussions are not shocking, and that the actions that can come out of the learning that we're sharing and imbibing the actions reflect data-driven decision-making that is taken in confidence and based on knowledge, and that is principle. And so I think that's where we're going, is trying to shift the narrative at the macro level, so that the broad-based understanding is one that is infused with and guided by an awareness and knowledge of what it means to be healthy, and of our ability to be partners in creating our personal and therefore collective health. That's what I think. Does that make sense to you?
It does, yes. It makes perfect sense.
So, Batala, where do we go from here? I think we're almost at the end of this program. It's been a wonderful program. I have so enjoyed this connection. I think it's critical and important. What are the next steps, Batala?
I think that the next steps is as Dr. Mosley just said, we continue to have these conversations publicly. We start to, like I've been saying, community organizing background, start knocking on some doors, listening to people, asking what people need. We're working in partnership with the Hawthorne area and the Jordan area. So it's continuing to connect. And for us, it's continuing to tell the stories, tell more stories, and just, inform people through our newspaper, through our channels, and grow the relationship, grow the project, and grow the movement, because that's what I see it as, a movement.
And Courtney, what are your thoughts?
I agree. I'm excited for spring. I don't know about you guys, because I feel like we can safely be convening a little bit more with the community outside. And so I think we're excited to be able to listen and hear more, show up more, and hopefully have the opportunity where it makes sense to be more accessible from a health perspective for folks to get to know who we are, that we're here for the long haul, and that we're in it together. So.
Well, let's call this a wrap for today's conversation, unless there's more you want to add, Batala.
I just wanted to see if Mosi wanted to jump in at all. Okay.
I only to echo what everyone's saying. I think
right on.
We keep it going. One of the benefits, one of the outcomes here is that we are all more connected now. We're all accessible. I hope that someone listening to this also feels that we're accessible and connected, and this is a mutual relationship that we'll continue to work on.
Right, and I was watching the Today Show this morning, and the anchorman, forgive me, I can't remember his last name, Craig, but his brother, one of his brothers, died from colon cancer at a younger age. And so he's doing a special on COVID cancer awareness, probably in men, maybe African-American men. And when he finished his segment, he said, if I could just save one life today. And I love that. And I think that's huge. If we could save one life today, if we can touch, a family today, a block, a neighborhood, then that's one way that we say we're successful. So if we could just save one person today, I think that's amazing.
Love it.
Love it too. Listen, thank you, Dr. Mosi Bennett. Thank you, Dr. Courtney Jordan Beckler. Thank you, Batala McFarland, for your leadership and what you're doing here. Okay. And you know what? To the listeners on YouTube or on Facebook, we want you to be involved to help drive this effort, this movement to create understanding, awareness, sustainability in our community. So either like the program or share it, and send us your questions. Tell us what we can do to be of greater support and relevance to you. This is about you. It's about us. We're glad to be here with you. Till next time, I'm Al McFarland, and we'll see you. Have a great day.